and welcome to another episode of Doc Talk Beverly Hills. My name is Ariel and we're here with board-certified plastic surgeon, Dr. Katzen.
Hi, Ariel. Hi.
Hi. So today we're going to be talking about ways to speed up your plastic surgery recovery and maybe a little bit about how to prepare. General advice.
Yeah, so general advice would be, that Boy Scout phrase, be prepared.
Mm-hmm.
So, you want to get ready for your plastic surgery. You just don't want to sort of say, yeah, okay, we'll see what just happens. No, you got to get ready for the procedure. You've got to talk to your plastic surgeon. Your plastic surgeon should have a list of things that they require before the surgery, and you may have to gather some things, all right? So in my practice, we're going to write you a prescription for antibiotics. So get all your prescriptions filled before the surgery, not after the surgery. You don't want to either you physically go or your family member to go to the pharmacy. You don't want to find out, oh, your pharmacy is closed, they moved, they don't have that antibiotic, you got to go elsewhere, your insurance plan doesn't carry it, etc., etc. You want to get all your prescriptions filled before surgery. So we're going to give you antibiotics, we're going to give you pain medication, we're going to give you something for nausea, stool softener, and something for your stomach to protect it from maybe getting an ulcer. So get all those ahead of time. You want to know what you're getting into. Second thing that's very, very important for my patient practice is nutrition after the surgery. So before the surgery, you want to continue your normal diet. You want to continue your normal exercise routine. You may actually want to step up your exercise routine because during the healing process, your body is going to preferentially try to eat up energy source being muscle. So it's going to attack some muscle a little bit. So you may want to bulk up a little bit, don't go crazy for that post-operative period. So for the post-operative period, for the nutrition, what I typically tell my patients is you want to try to get about 100 grams of protein in a day. Mm-hmm. And typically most of my patients lose their appetite after the surgery. So the best way to get in those 100 grams of protein is with a liquid shake or liquid protein. We like a product called Premier Protein, a lot of different flavors. Chocolate's the best, but you can have it cold, you can have it hot. But basically it has about 30 grams of protein per box. So if you want to get in 100 grams, you're going to have 3 plus a little bit more. You can put them all in the fridge, put them on the counter, doesn't matter. But by the end of the day, I want you to get in not 1, not 2, but 3 and a little bit more of those cartons of 30 grams of protein. So protein's essential to healing, whether you're having a tummy tuck, or body lift, or a thigh lift, or arms. Very, very important to get that protein in.
Do you also suggest that people are having surgeries like tummy tuck or like a 360 body lift where their clothes size might change a little bit? Do you suggest they get that clothes beforehand?
No. Get all the clothes afterwards. During the post-operative recovery, you want nice, loose-fitting clothing, and that's also in the process of getting prepared. So you want to prepare yourself for loose-fitting clothes. You really don't want to be wearing t-shirts where you have to stretch your arms to get yourself into the shirt. You want to have shirts that button in the front or clip in the front. For pants, they have these like basketball pants that have clips on the sides where you can just rip the pants off to get in and out of them. It's much easier to get in. For women, skirts, sundresses, where you can just step into the dress and just pull it up are very good, easy ways to recover. Robes also, things that are loose and fitting. You don't want tight, constrictive stuff because you're going to be swelling, you're going to be uncomfortable. You want loose fitting stuff. So that's the clothing. Also in your recovery center, wherever you're going to recover, maybe it's your sitting room or your bedroom, you want things sort of down at a low level. You don't want a very high bed, or if you do have a high bed and can't get a lower bed, maybe you want to arrange for steps into the bed. Mm-hmm. You want to also have access to your phone and your phone charger. You want everything sort of very close to you. I'd also think about maybe getting a small fridge, putting it bedside, so you have your shakes, you have your drink, you have your water right next to it, and you can sort of get to it whether you need to. We like somebody to be there. It doesn't have to be a doctor, it doesn't have to be a plastic surgeon or even a nurse. It just has to be someone that can get you from the bed to the bathroom, get you maybe some food to eat, something to drink, getting you from your bed up to the sitting room, bed to the living room, and maybe from your bed to the appointments where we see.
Mm-hmm. And then maybe some type of entertainment for while you're in bed.
Yeah, so a little bit of entertainment. Just realize that your body is going to be tired. It's going to be tired from the anesthesia. It's going to be tired because your body's physically taking energy to help everything heal. Your body just doesn't sit there and heal. It actually uses energy, calories, to heal up that scar, that incision line, to help everything glue back together. That requires energy. So your body's going to be sucking up a lot of that protein that you're drinking and some of the extra that you're using, so your body's going to be tired. So don't think, oh yeah, I can catch up on all my Netflix series, I'm going to watch this, I'm going to do that, and I'm going to read this book. No, your body's going to be tired. So just kind of sleep it off. But if you want some entertainment, yeah, set up a little studio, a little cave, if you will, of a recovery center.
So this is how to prepare physically.
Yeah.
What about mentally?
Yeah, mentally is sort of up to you. The very important thing that I remind patients is when we're doing these surgeries, we're removing fat, whether it's liposuction, tummy tuck, body lift, arms, thighs, etc. We're removing fat. So fat is like a sponge, and it can harbor a lot of hormones. So when we're removing fat, that has a lot of hormones in it. Some people get this roller coaster of emotions after the surgery, whether they're happy or they're sad or, etc.
That's interesting.
That's by just physically removing the fat, which has been saturated with hormones. So people just get that roller coaster and they think it's due to themselves, they think it may be due to the medication, but in actuality, a lot of the time it's just done from the physical nature of removing the fat. So that aside, mentally you do need to prepare. You need to prepare of, yeah, it's going to hurt, but you're going to get through it. We're going to give you pain medication. We're going to be there on the phone if you ever need us. We're going to get you through this. Also, you may want to inform family that you're going through this to not surprise them, but just to have them aware, and they can ideally help you through this healing process.
The emotions going up and down, about how long does that take to settle down?
Everybody's different. Some patients, they don't get that roller coaster. Some patients, it's 1 or 2 days. That's probably the most common. Some patients, it can be a little bit longer, weeks or even months. It just depends on the patient.
And what about when it's transferred? Fat is transferred to somewhere else. Is that a similar thing?
That's a good question. I really haven't seen that. Typically, when we're removing the fat with liposuction, you may get that little roller coaster even if we're transferring the fat. And then also very important to coordinate with your plastic surgeon if you're taking any mood-altering medication, psychiatric medication, work with them either to continue it, taper your dose, increase your dose, etc., because those may be altered with your surgery. So it's very important to be in touch with your plastic surgeon on what to do with those specific medications. There are some specific psychiatric medications which we adamantly have you continue. You cannot stop taking those. And there are some others which we can have you skip and fluctuate and sort of alter depending on the pain medications that you're taking.
And have you ever noticed patients that are more stressed out about something, whether it's like getting back to work really quickly? Does that tend to delay their healing?
Yeah, so stress is not a good thing, all right, in terms of the healing. Stress causes inflammation, causes prolonged healing. Not a good situation to be in. So if you're stressed, try to reduce your stress level, whether it's through meditation. Medication too can also help. A lot of patients get sort of trapped in this, oh, my friend Susie, she had liposuction and she was back to work the next day. So you're comparing you to a friend who may or may not have had the same procedure by maybe a different surgeon who has a different job and a different age and different metabolic criteria. So don't compare yourself to others. You're you with your plastic surgeon and your technique, so you're going to heal up differently. So just go with that pace. If you're concerned about your accelerated or delayed healing, call up your plastic surgeon and going, hey, what's going on? Is this normal? Usually, it is normal.
So basically allow yourself that time to heal. Take off from work for enough days to prepare.
Absolutely. Absolutely. And again, in that preparation of the surgery, the upcoming surgery, work with your plastic surgeon. What's the anticipated time for, return to what we call activities of daily living? Puttering around the house, getting your own food, going to the bathroom, to the next level of returning back to work. Maybe it's half-time, full-time. Just sort of get a feel for that before the surgery, not after the surgery going, okay, I had a friend who does a similar job and she was able to get back to work 3 days after her tummy tuck. That may not be you. And adding to further stress, further delay in healing, further delay in returning to work. Not a good situation.
Okay, so basically talk to your plastic surgeon, allow yourself time to heal.
Yeah.
And you'll be okay.
You'll be okay.
You're going to make it through.
Yeah.
Yeah, awesome. So if you have any more questions, you could contact your plastic surgeon or Dr. Katzen, who is here in Beverly Hills. You could call him at 310-859-7770, or you can message us on Instagram, on YouTube, anywhere.
Yep, so give us a call.
Alrighty, thanks so much, and we'll see you next week.
Thanks. Bye.